लंग कैंसर को डिस्कस करेंगे। तो स्टार्ट करते हैं। व्हाट इज लंग कैंसर? लंग कैंसर क्या है? एबनॉर्मल सेल ग्रोथ इन द लंग्स। Which of the following is the leading cause of lung cancer? So right option A, D, smoking, tobacco. Which type of lung cancer accounts for the majority of cases? So right option A, B, non-small cell lung cancer. What is the commonly symptom of lung cancer? So right option A, persistent cough. Which imaging technique is commonly used for the diagnosis and staging of lung cancer? So right option A, C, CT scan. Which of the following is a risk factor for developing lung cancer besides smoking? So right option A, B, air pollution exposure. What is the term for cancer that has spread from the lungs to the other part of the body? So right option A, metastatic lung cancer. Metastatic lung cancer refers to a cancer that originated in another part of the body and has spread to the lungs. This type of cancer, also known as a secondary lung cancer. Which of the following is not a common treatment for lung cancer? So right option है एंटीबायोटिक। नॉट है तो एंटीबायोटिक या सर्जरी हम करते हैं या कीमोथेरेपी या रेडिएशन थेरेपी। Which of the following is a known risk factor for developing lung cancer? So right option is C, occupational exposure to asbestos. एस्बेस्टोस क्या है? ये एक मिनरल फाइबर है, ये सनती मसनूआत में इस्तेमाल होता है। अगर ये एस्बेस्टोस सांस के जरिए अंदर चला जाता है तो इससे फेफड़ों का कैंसर बन सकता है। What is the most common symptom of advanced lung cancer? So right option is B, bone pain. Which of the following is a characteristic feature of small cell lung cancer? So right option is early metastasis. ये क्या है? अर्ली मेटास्टेसिस में कैंसरस सेल दूसरी जगह फैल जाते हैं जिससे कैंसर बहुत तेजी से फैल जाती है। विच ऑफ द फॉलोइंग इज नॉट ए कॉमन साइट ऑफ लंग कैंसर मेटास्टेसिस? सो यहाँ नॉट की बात हो रही है तो राइट ऑप्शन है सी, स्प्लीन। व्हाट इज द प्राइमरी कॉज ऑफ स्मॉल सेल लंग कैंसर? सो राइट ऑप्शन है स्मोकिंग टोबैको। Which type of lung cancer is most commonly associated with smoking? So right option is B, squamous cell carcinoma. What is the primary goal of lung cancer treatment? So right option है C, cure of the disease, के मरीज मुकम्मल तौर पर सेहतयाब हो जाए। Which of the following is a potential complication of lung cancer? So right option is C, pneumonia. What is the term for cancer that has recurred after initial treatment? So right option is C, recurrent cancer. Which of the following is a common side effect of chemotherapy in lung cancer patients? So right option is hair loss. Which of the following is a staging system commonly used for lung cancer? So right option is A, TNM staging. TNM staging system ये एक तरीका है जिसमें T मीन ट्यूमर, तो मतलब ट्यूमर कितना बड़ा है, N मीन नोड, इससे मालूम होता है कि लेम्फ नोड में फैला है या नहीं, M मीन मेटास्टेसिस, इससे मुराद कि कैंसर दूसरे ऑर्गन में फैला है या नहीं। What is the term for surgical removal of lung lobe affected by cancer? So right option A, B, lobectomy. Acute respiratory failure को डिस्कस करने जा रहे हैं। So what is acute respiratory failure? So option A, B, inability of the respiratory system to maintain adequate gas exchange. इससे क्या होता है कि रिस्पिरेटरी सिस्टम फेल हो जाता है जिसमें पेशेंट ऑक्सीजन इनहेल और CO2 को एक्सहेल ठीक से नहीं कर सकता और रेस्पिरेशन इसमें फेल हो जाता है। Which of the following condition is not a common cause of acute respiratory failure? So right option है एनीमिया। नाट की बात हो रही है तो एनीमिया, ये नमूनिया COPD से भी हो सकता है और पल्मोनरी एम्बोलिज्म से भी हो सकता है। What is the hallmark sign of acute respiratory failure? So right option है साइनोसिस, जिसमें स्किन की कलर और जिसमें डिसकलरेशन हो जाता है। Which are the following is a clinical manifestation of acute respiratory failure? जिसमें Right option A B, tachypnea. Tachypnea, rapid breathing. It's mean respiratory breathing greater than 20 breath per minute. Which type of respiratory failure is characterized by an elevated arterial partial pressure of carbon dioxide? So right option A D, hypercapnic respiratory failure. Hypercapnic respiratory failure is a life-threatening condition characterized by inability of the respiratory system to remove carbon dioxide from the body. Which of the following condition is commonly associated with hypercapnic respiratory failure? So right option A asthma exacerbation. What is the initial management priority for patient with acute respiratory failure? So right option is C, supplemental oxygen therapy. Which of the following is not a potential complication of acute respiratory failure? So right option A D, hyperglycemia. Which imaging modality is commonly used to evaluate lung function in acute respiratory failure? So right option A, chest X-rays. Which of the following laboratory test is commonly performed in the evaluation of acute respiratory failure? So right option A complete blood count. Which of the following intervention is used to manage hypercapnic respiratory failure? So right option A B, non-invasive positive pressure ventilation. Non-invasive positive pressure ventilation is a type of ventilation therapy that deliver air pressure into the lung through a mask or device. Which of the following is a potential cause of hypoxemic respiratory failure? So right option is C, pulmonary embolism. Which of the following is a sign of impending respiratory failure? So right option is D, use of accessory muscle. ये मसल ये गर्दन के पट्टे या कंधों में होते हैं. What is the goal of oxygen saturation range for patient with acute respiratory failure? So right option A 90 to 92%. Which of the following medication is commonly administered to reduce airway inflammation and acute respiratory failure? So right option is C, methylprednisolone. Which of the following condition can lead to acute and chronic respiratory failure? So right option A, C, chronic obstructive pulmonary disease exacerbation. Which arterial blood gas parameter is typically elevated in hypercapnic respiratory failure? So right option A, PaCO2. Which of the following is a potential complication of prolonged mechanical ventilation acute respiratory failure? So right option is C, ventilator associated pneumonia. What is the primary treatment for hypoxemic respiratory failure? So right option A high flow oxygen therapy. Acute respiratory distress syndrome को डिस्कस करने जा रहे हैं जो पेपर के हवाले से इंतहाई इम्पोर्टेंट है. तो स्टार्ट करते हैं. व्हाट इज एक्यूट रेस्पिरेटरी डिस्ट्रेस सिंड्रोम? तो ऑप्शन ए a severe form of acute respiratory failure. Which of the following is a characteristic feature of ARDS? So right option A B, bilateral pulmonary infiltrate on imaging. What is the primary cause of ARDS? So right option A D, all of the above. Which of the following condition is commonly associated with the development of ARDS? So right option A C, sepsis. What is the hallmark pathophysiological mechanism of ARDS? So right option is C, alveolar and endothelial injury leading to increased permeability. Which of the following condition is a risk factor for developing ARDS? So right option A, obesity. What is the main symptom of ARDS? So right option A, dyspnea, difficulty in breathing. Which of the following condition can trigger the development of ARDS? So right option A, C, inhalation of smoke or noxious fumes. Which of the following is a potential complication of ARDS? So right option A hypertension. Which imaging modality is typically used to diagnose ARDS? So right option A, X-rays. What is the primary treatment for ARDS? So right option is C, mechanical ventilation with low tidal volumes. Which of the following complication is associated with mechanical ventilation in ARDS patient? So right option A, barotrauma. What is the term for the phase of ARDS characterized by diffuse alveolar damage and acute inflammation? So right option A, exudatio phase. Which of the following condition is a common predisposing factor for ARDS in hospitalized patients? So right option A, C, sepsis. Which of the following parameter is often used to assess the severity of ARDS? So right option A, C, lung compliance. What is the mainstay of supportive therapy for ARDS? So right option is C, prone positioning. Which of the following is not complication associated with ARDS? So right option A, D, hypercapnia. Which of the following is a potential long-term consequence of ARDS? So right option A, pulmonary fibrosis. Chest trauma को डिस्कस करने जा रहे हैं. So what is chest trauma? Injury to the organ inside the chest cavity. चेस्ट ट्रॉमा क्या होता है? जब प्लूरल कैविटी में ऑक्सीजन की अकुमुलेशन हो जाती है तो इसकी वजह से ऑक्सीजन की सप्लाई कम हो जाती है. जब ऑक्सीजन की सप्लाई कम हो जाती है तो इससे खून की वापसी कम हो जाती है जिससे दिल कम खून पंप करता है. सो चेस्ट ट्रॉमा इंजरी टू द ऑर्गन की इंजरी हो जाती है इनसाइड द चेस्ट कैविटी. Which of the following organ is not typically affected by chest trauma? So right option है liver, क्योंकि liver chest cavity से बाहर है. What is the most common cause of chest trauma? So right option है motor vehicle accident. Which of the following symptom is characteristic of Tension pneumothorax, a potential complication of chest trauma? So right option है B, hypotension, जिससे ब्लड प्रेशर गिर जाता है और जिसको हम मेडिकल में हाइपोटेंशन कहते हैं. Which imaging modality is commonly used to diagnose chest trauma? तो right option है CT scan. What is the term for a collection of air or gas in the pleural cavity that lead to lung collapse commonly seen in chest trauma? So right option है D, pneumothorax. Which of the following is a common initial management step for chest trauma? So right option is C, stabilizing of the patient airway, breathing and circulation. A, B, C. Which of the following is a sign of flail chest, a severe chest trauma complication? So right option A, paradoxical chest move. पैराडॉक्सिकल चेस्ट मूवमेंट क्या होता है? ये इस वक्त होता है जब सीने की दीवार का एक हिस्सा उलट अंदाज में हरकत करता है, यानी इंस्पायरेशन पर मुतासरा हिस्सा अंदर की तरफ चला जाता है जबकि बाकी सीना बाहर की तरफ. इसी तरह इंस्पायरेशन में मुतासरा हिस्सा बाहर की तरफ और बाकी सीना अंदर की तरफ जाता है और इसकी वजह फ्लेल चेस्ट है, यानी 2-3 रिब्स की टूटने से हो सकता है. What is the term for the accumulation of blood in the pleural cavity as a result of chest trauma? So right option A, B, hemothorax. What is initial step in managing an orphan pneumothorax, also known as sucking chest wound? So right option A, applying an occlusio dressing taped on 3 sides. orphan pneumothorax या sucking chest wound एक खतरनाक हालत है जो इस वक्त होती है जब सीने में खुला जख्म हो और हर सांस के साथ हवा अंदर और बाहर जाने लगे. तो ये पट्टी जख्म बंद करती है ताकि हवा अंदर ना जा सके. तो ये पट्टी 3 तरफ से बंद करने से क्या मकसद होता है? इससे होता ये है कि जब मरीज सांस बाहर निकाले तो जख्म के अंदर फंसी हुई हवा बाहर निकल सके, लेकिन जब वो सांस अंदर ले तो इस पट्टी की वजह से हवा अंदर नहीं चलता. Which of the following structure is most commonly injured in blunt chest trauma? So right option है diaphragm. Blunt chest trauma ये किसी सख्त चीज के टकराने की वजह से होती है जिससे अंदरूनी ऑर्गन से नुकसान पहुंच जाता है. What is the term for the condition where air accumulate in the mediastinum, often seen in severe chest trauma cases? So right option है pneumomediastinum. Which of the following is a potential complication of chest trauma related to the heart? So right option is B, pericardial tamponade. Which of the following is a common symptom of chest trauma? So right option is D, chest pain. What is the term for a severe chest injury where multiple adjacent ribs are fractured and 2 or more places, resulting in a segment of the chest wall moving independently? So right option is प्लेल चेस्ट, जिसमें 2-3 रिब्स टूट जाते हैं. Which of the following is not a potential treatment option for chest trauma? यहाँ नॉट की बात हो रही है तो ऑप्शन है सी, एडमिनिस्ट्रेशन ऑफ एंटीकोगुलेंट. अगर हम एंटीकोगुलेंट देते हैं तो ब्लीडिंग मजीद बढ़ सकता है. What is the primary goal of managing chest trauma in the acute phase? So right option is C, stabilizing of the patient condition. Which of the following condition is a potential complication of rib fracture and chest trauma? So right option है C, pneumonia. तो इससे क्या हो सकता है? pneumonia हो सकता है. What is the term for the condition where blood accumulates in the pericardial sac, compressing the heart and leading to the decreased cardiac output? So right option है cardiac tamponade. Which of the following is a potential complication of chest trauma involving the respiratory system? So right option है B, pulmonary embolism. ओके, थैंक यू. इसके साथ हमारा लेक्चर खत्म होता है. मिलते हैं नेक्स्ट वीडियो में. अल्लाह हाफिज.